Many people check their blood sugar wrongly, and this can affect the result. In this video, I'll be showing you the correct step-by-step method on how to check your blood sugar using an Accu-Chek Glucometer. Blood sugar, also called blood glucose, is the amount of sugar present in the blood. It is the body's major source of energy. When we eat food, the body breaks it down into glucose, which is the main source of energy for the body. Insulin then helps move this glucose from the blood into the body's cells, where it can be used for energy. When blood sugar becomes too high or too low, it can become dangerous and affect normal body function. These are the symptoms of high blood sugar: excessive thirst, frequent urination, blurred vision, and tiredness. And for symptoms of low blood sugar, sweating, dizziness, confusion, and when blood sugar is too low, it can lead to an emergency. Who should check their blood sugar? Pregnant women, diabetic patients, people with family history, and people that have symptoms like excessive urination, blurred vision, and other symptoms mentioned earlier. There are 3 types of blood sugar tests. We have the fasting blood sugar test, random blood sugar test, and the HbA1c blood sugar test. And today we'll be demonstrating the random blood sugar test. Quite funny how they look alike, but not exactly the same. This pack comes with an Accu-Chek strip, 10 pieces, while this pack does not have any Accu-Chek strip. Now let's get into it. Hello everyone, welcome to Health and Fitness with Goodness. Today I'll be showing you step-by-step method on how to check your blood sugar level using an Accu-Chek Glucometer. Stay tuned. Open the Lancet pen. Open it. Insert Lancet properly. Finally adjust the depth. Adjust it to suit the skin of the patient. These numbers here represent depth of the needle puncture. 1 to 2 low, 3 to 4 moderate, and 5 is the highest depth. So you set according to your patient's skin thickness. Once everything is set, you test run your pen. This is how to use it. In this video, I'll be testing myself. If you're testing someone else, make sure to wear latex gloves. I prepared a cotton swab by soaking it up in a methylated spirit. Properly clean up the site about to be punctured to avoid infection. Fix the battery into the glucometer and test. The glucometer automatically goes on when the strip is on and not when the battery is lit. Once you insert the strip, prepare your finger for acupuncture and then place the blood once there is a red beep at the glucometer and the strip. Result comes up shortly. For fasting, we have 70 to 99 or 100 milligram per DL as our normal range, and as for the random, less than 140 milligram per DL is normal. Meanwhile, results should always be interpreted by your healthcare provider. These are the best time to check your blood sugar level: before meals, after meals, when you are feeling unwell, or when you're directed by your healthcare professional to check your blood sugar. Common mistakes people make while using Accu-Chek strip: reusing, overusing of the Lancets, using little or not enough blood samples, not maintaining or covering the strips properly, using expired strips, dirty or wet hands for the test. Safety and hygiene: wash your hands properly. Do not share Lancet with anybody. Make sure you dispose your Lancets properly and cover the strips. This is how to store your glucometer strips accurately. You have to keep them dry, avoid heat or moisture, and make sure they are properly closed. If you found this video helpful, you should like, share, subscribe, and send to someone who might need this video. See you in the next health video.